Hi, my name is Lily Jackman, and I am a registered nurse and the LVAD coordinator for Lovelace Medical Center. I started working in the cardiovascular ICU at the Heart Hospital, New Mexico, then transitioned to my current role as part of our advanced heart failure team at New Mexico Heart Institute. It's been a privilege to help grow our heart failure program and increase awareness about heart failure throughout the state of New Mexico. Today I'll be talking to you about congestive heart failure with a focus on systolic heart failure. To get started, I would like to review basic anatomy and function of a healthy heart.
We have 4 chambers in our heart. The top 2 are known as our atriums. Deoxygenated blood enters the right atrium from the body, and then the oxygenated blood enters the left atrium from the lungs. Our 2 lower chambers are considered the pumping chambers of the heart. These are known as your ventricles. The right ventricle helps pump blood to the lungs to be oxygenated, and the left ventricle helps pump oxygenated blood out to the body. A patient develops systolic heart failure when one or both chambers can no longer effectively pump blood out of the heart, causing backup into the body or lungs. This is known as systolic heart failure. Congestive heart failure is a general term that covers many types of heart failure. A brief overview of some different types of heart failure include systolic versus diastolic heart failure. Systolic heart failure occurs when the left side of your heart is too weak to pump blood out of your body. This affects the strength of your heart to contract. Diastolic heart failure occurs when the chambers of the heart are unable to relax and allow the heart to fully fill with blood in order to pump out to the rest of the body. This is an issue with a relaxation. The systolic heart failure is an issue with contraction. There are 2 causes of heart failure. These are known as ischemic and non-ischemic. These both can affect your left ventricle, right ventricle, or both, which would be known as biventricular failure. Normal heart function requires both a relaxation phase in order for the heart to fill with fluid, and it also requires a contraction phase, which is the strength required to push the collected blood within the heart out to the rest of the body. I'd like to briefly touch on heart failure here in New Mexico. We are going to look at the population versus the amount of heart failure you have. We have about 2 million people living in New Mexico, and we have about 35,000 those have been diagnosed with heart failure. Out of those patients, about 3,500 of them have what's called advanced heart failure. Having advanced heart failure means that you are either needing a heart transplant, you're on a list for a heart transplant, or you are going to be going for a mechanical assist device to assist with this, or you're going to hospice. Last year, the United States transplanted around 3,600 new hearts into patients with advanced heart failure nationwide. So if you have 3,500 here in New Mexico alone needing a heart transplant and only do about 3,500 per year in the United States, there's a major gap in treatment and leaving our residents all over the United States without many options. If we can catch heart failure early, we can treat it and we can slow its progression. And so we'll talk about early stages of heart failure, how to slow that progression, and what you can do to remain out of the advanced heart failure population. So now let's shift our focus to systolic heart failure. This is the most common type of heart failure, and it most commonly affects the left ventricle. If the left ventricular failure is not treated, this will create a fluid backup into the lungs and then into the right ventricle, which can also fail. Left ventricular failure causes the backup of fluid from the left ventricle into the lungs, creates signs of shortness of breath, an inability to lay flat, and coughing and wheezing. If this is not treated, it will then continue to back up into the right ventricle, causing it to fail. As the right ventricle is unable to push blood forward to the lungs, it's going to back up into the body and create a state of congestion throughout the body. Signs of this are swollen ankles and feet. You might have a bloated, tight belly, and you might have symptoms of lack of appetite, nausea, or any kind of GI symptoms. Some other symptoms that may occur with both right and left systolic heart failure include feelings of fatigue, lightheadedness, and confusion. You may have a high heart rate, and it can impair your other organs, such as your liver or kidneys. Because blood is pumped out to the body via the left ventricle, when this function is low, the blood cannot move forward out of the heart, creating a backup of fluid into the lungs and eventually into the body. This is where the term congestion comes from. The body is congested with fluid related to the inability of the heart to push the blood forward. Not only is the body congested with fluid, but organs such as the brain and kidneys may not receive adequate amounts of oxygenated blood, causing additional organ damage. Let's talk about some causes or etiologies of systolic heart failure. There are two primary etiologies known as ischemic versus non-ischemic. With ischemic cardiomyopathies, this is due to inadequate blood flow through the arteries that supply oxygenated blood to the heart tissues. This is also known as coronary artery disease. When untreated, coronary artery disease can lead to a heart attack, or also known as myocardial infarction. Infarctions result when the lack of blood flow causes irreversible death to a portion of the heart tissue, which can cause a significant reduction in heart function, leading to a systolic heart failure. Now, non-ischemic cardiomyopathy is heart failure not related to coronary artery disease. This can result in a large dilated heart or a thick wall muscle, reducing the ability for the heart to push adequate volume out to your essential organs, such as your kidneys and brain. Some identified causes include viral infections, valvular diseases, chemotherapy-induced cardiomyopathies, chronic high blood pressure. There are genetic predispositions, or it runs in your family. Substance abuse with alcohol, meth, or cocaine is another common one. Sometimes we cannot identify the cause of non-ischemic cardiomyopathy. This we call idiopathic. A thick heart muscle with a small filling chamber is considered hypertrophic. A large, thin ventricle is considered dilated. Despite what caused the patient's heart failure, diagnosis and treatment is often similar or the same, and we will discuss this on the upcoming slides. Diagnosing heart failure. So, diagnosis of heart failure is a combination of subjective and objective information. Your doctor will ask you about your symptoms and tolerance when performing different activities. A common classification system used to describe heart failure is known as the New York Heart Association Functional Classification. Your doctor will talk with you about your symptoms in order to determine which class you are in. Your doctor will also order testing to give them some additional objective information about your heart function. They will use the subjective and objective information to diagnose your stage of heart failure. Ejection fraction definition is the percentage of blood that is ejected from the left ventricle with each contraction. A normal ejection fraction is 50 to 75% in adults. Your doctor will order an echocardiogram to look at your ejection fraction. When your ejection fraction is less than 35%, you are considered nearing advanced heart failure. Less than 25% is advanced heart failure, and your doctor may start talking with you about additional advanced therapies such as a heart transplant or LVAD. They may also order a test called heart catheterization, which is used to look for coronary artery disease or elevated right heart pressures. This will give them information on whether your heart is ischemic or non-ischemic, and this will also provide information on your cardiac output. Cardiac output is the amount of blood the heart pumps through the body in 1 minute. Normal cardiac output is about 5 to 6 liters of blood pumped each minute. When a patient has both a low ejection fraction and low cardiac output, the heart is weak and is struggling to push blood forward, creating the backup into the body. Once diagnosed, your doctor will talk with you about the next steps in treatment. Treating your heart failure. Treatment for heart failure requires the participation of both the patient and their medical providers. Unless both entities are working together, treatment is unlikely to be effective. Some of these treatments include making necessary lifestyle changes, attending appointments, following the instructions from your provider regarding medications and testing. Your provider will order necessary testing, adjust medication, and provide education in order to prevent worsening heart failure and avoid hospitalizations. Using both the subjective data provided from the patient and the objective data seen on the testing, we can use this to diagnose and stage the severity of your heart failure. Over the next few slides, we will review some of the necessary actions required by both patient and provider to treat your heart failure. These include lifestyle changes, medications, procedures, and sometimes surgery. The first thing I would like to discuss are lifestyle changes. These, in addition to the necessary medications, can greatly affect and reduce the amount of symptoms you experience and slow the progression of your heart failure. These include weighing yourself daily, taking your medications as prescribed, eating a healthy, low-sodium diet, remaining physically active, and avoiding smoking and drinking alcohol. Now, daily weights you would do each day in the morning. The best time of day to do this is before you have had breakfast and after your morning pee. This is the most neutral time of the day. You are watching for sudden increases. If you gain more than 2 to 3 pounds in 2 days, or if you gain more than 4 to 5 pounds in 5 days, you should call your doctor right away because you could be retaining fluid. There are things we can do with you over the phone to help reduce some of these fluids, such as increasing your medications. Tips for your daily weights. Once again, you want to weigh yourself in the morning right after you wake in and after you urinated. You should wear the same amount of clothes each time you weigh yourself and try to use the same scale. You want to put your scale on a flat, hard surface, not on a rug or a carpet. Do not just stop weighing yourself. If you forget one day, that's okay. Just restart again the next morning. Write down your weight each day on a chart, and then you can bring this with you to your appointments, and it will help your doctor address any medication changes. Limiting sodium. Sodium is a contributing factor to why you retain fluid. It causes extra fluid to build up in the body, which causes worse symptoms, such as swelling and shortness of breath. Most providers recommend limiting sodium to 1,500 to 2,000 milligrams per day. It's important to read your food nutrition labels. There are hidden sodiums in many foods that we eat. You want to avoid processed foods such as frozen dinners, canned soups, lunch meats, and others. Eating at home can really help reduce your sodium intake. Some additional tips for lowering your sodium is do not add salt to your food while you are cooking. Take the salt shaker off the table. You want to pick food that is naturally low in sodium, like fresh fruits and vegetables and fresh meats. Always read food labels. This is very important because of those hidden sodiums. You want to avoid snack foods with visible salt on them, such as crackers, pretzels, potato chips, salted nuts. Only buy canned vegetables that say no sodium. Sodium can be used as a preservative and often is used in canned food because of that quality. Always ask your healthcare provider what your sodium limit per day is. Use more low sodium spices, herbs, seasonings, and condiments such as allspice, basil, bay leaves, black pepper, and many others as you see on the slide. There are ways to season your food without using sodium, and we can talk with you about this at your provider visit. These are 6 common foods that will increase sodium that we see in our everyday lives. Bread and rolls, cold cut cured meats, sandwiches, pizza, canned soups, and chicken. You want to remain physically active. The benefits of walking is important to do regularly. You want to aim to exercise at a moderate intensity, and you want to increase this intensity in intervals that allow you to become more and more strong and allow your heart rate to remain normal. In week 1, you could start with a stroll. By week 5, you could be at a comfortable brisk that lasts about 20 minutes. By week 9, hopefully you are able to do 1 hour at a comfortable brisk. Some benefits of exercise include lowering your blood sugar, lowering your blood pressure, giving you more energy. They help reduce heart failure complications, controls your weight, it decreases stress, and reduces shortness of breath. Some tips are relax for at least 30 to 60 minutes between eating and starting your exercise. Your physician will give you restrictions for lifting, so you may ask to avoid straining and lifting heavy objects, such as a window or unscrewing jar lids. This type of pressure or tension can decrease blood flow to the body, causing a sudden increase in heart rate and blood pressure, and can deprive your muscles of the oxygen they need. You want to avoid straining when you are having a bowel movement. Ask your doctor about a laxative or stool softener if you become constipated. Now we can talk about our heart failure medications. These are used to reduce what we call remodeling of the heart. This refers to changes in its size, shape, and structure that can influence the function of the heart. This occurs due to mechanical stress the heart muscle faces, so the heart attempts to compensate for any damage that occurs. The heart thinks it's helping, but it's actually hurting. It is the heart's attempt to fix or change itself in order to continue to function with the associated damage. Unfortunately, as the heart continues to remodel itself, it can create a reduced blood supply to the heart, worsening heart function, increasing abnormal heart rhythms, and including one of those being AFib, which will increase your risk of stroke. With the addition of angiotensin-converting enzymes, angiotensin receptor blockers, beta blockers, and aldosterone antagonists, you will have a reduction in the remodeling of the heart, such slowing the disease and lowering the risk of death. Many providers are also utilizing newer medications, such as Entresto, in place of your ACEs or ARBs. Speak with your doctor about which medication regimen is best for you. I'm going to go over a little bit more about these different types of medications. ACE inhibitors stand for angiotensin converting enzyme inhibitors. These expand blood vessels and allow more blood flow to reach the organs more easily. And it also helps reduce the amount of work on the heart. Antiarrhythmic agents prevent abnormal heart rhythms. ARB stands for angiotensin receptor blockers. These are similar to ACE inhibitors. They also expand your blood vessels to help the blood flow through your body more easily. Your doctor will either put you on an ACE inhibitor or an ARB. You would not be on both. Beta blockers help reduce the workload of the heart. They may slow your heart rate down, and they may also expand your blood vessels, allowing that blood flow to improve. Diuretics are medications that help remove excess water. These are what we may increase if you have a weight increase. You will remove this water by urinating. Hydralazines and nitrates also help reduce the workload of the heart by lowering blood pressure and lowering what they call afterload. And this helps the blood reach the essential organs more easily. The purpose of all of these medications are to lower the workload of your heart and reduce and prevent remodeling of the tissues. Your doctor will continue to increase the dose of your medication as high as your blood pressure will tolerate. Some tips for managing your medications. You may end up on quite a few medications, and it can be difficult to keep track. So here are some tips to help managing them. You may want to get a medication chart. You should keep a list of all of your medications and what dose you're on, how often you take it, and what time of day you should be taking it. You also might have special instructions, such as if you should take them with food or if you should take them after or before another medication. Ask questions to help you better understand why these medications are important. Check your labels. Make sure you are on the medications that you have been told you're on. Take the med at the same time each day. Tell your provider about any over-the-counter medications or supplements you take. Report new side effects right away. Do not take your medications in the dark, and always carry your med list on you. Another tip would be to obtain a pill box and help yourself by setting up your pill box each week. So that way it's easy to take your medications and you don't have to worry about making sure you do not forget a medication. Being diagnosed with heart failure creates many lifestyle changes that can be difficult for both the patient and the family to cope with. It may produce feelings of anxiety, fear, anger, or sometimes helplessness. We want to help relieve any feelings of anxiety or stress that we can. Some tips for feeling better and coping with your heart failure include getting out and about. Plan to do things with your friends and family. Do the things that you enjoy. Take walks with your friends and family. Visit your neighbors. Talk with your friends and family about how you are feeling. If you're having feelings of anxiety or depression that won't go away, talk with your healthcare provider. Practice simple relaxation techniques such as deep breathing and visualization. I would encourage you to ask your provider about possible support groups in your local area or about seeking counseling. Cardiac rehab can also be a good way to get out of the house and meet others going through a similar situation. You want to do activities to improve your overall well-being and health, but also remember to do the things you enjoy. If there is an activity you are not sure about, ask your healthcare team for guidance. We want you to have quality with your heart failure as much as you can, and we do not want you feeling like you have to refrain from doing the items that you enjoy. The American Heart Association has created a heart failure zone. We know which zone you're in by you documenting your daily weight before breakfast, taking your medication, checking for swelling in your feet, ankles, and legs and stomach, eating low salt, and balancing activity. So each day when you wake up, I want you to ask yourself, what zone am I in today? Are you in the green zone? The green zone means you're all clear. Your symptoms are under control. You do not have any shortness of breath. You have not gained weight. You have no swelling in your ankles, legs, or stomach, and you have no chest pain. If you are in a yellow zone, this is a warning zone. You would want to call your doctor's office. This is when you have a weight gain of 3 pounds in a day or 5 pounds in 1 week. If you're feeling more tired, no energy, or more shortness of breath. If you're feeling uneasy or dizzy, and you know something is just not right. More swelling in your feet, ankles, legs, or stomach. A dry, hacking cough, or it is harder to breathe when laying down, and you need to sit up, sleeping in a chair. This is a good time to call your doctor's office. Now, if you are in the red zone, this is an emergency. You're going to want to go to the emergency room if you have a ride. If you do not have a ride, you need to call 911. This is when you are having extreme struggle to breathe, especially when laying flat. If you are unable to lay flat or wake up suddenly gasping for air from sleep, this is a red zone symptom. If you have chest pain, this is also red zone. And if your family member is having confusion or cannot think clearly, this is also a good time to call 911 or go to the emergency room. Now, I wanted to talk about Lovelace's heart failure program. Patients who join our program will go through the following evaluations. They will meet with one of our heart failure providers who will consult to assist with medication adjustments, testing, and the next steps. The next steps may include consulting with additional cardiologists, such as your electrophysiology or interventional cardiologist. These cardiologists can help identify if you are needing other interventions that could perhaps reduce the exacerbation of your heart failure or even improve your heart failure. We may also suggest the placement of a small device to help you monitor your fluid status from home, with the goal of avoiding hospitalizations. If your heart failure progresses despite the above interventions, your provider may bring up advanced therapies such as heart transplant or left ventricular assist device. Another test we offer is known as a HeartScan. Talk to your primary care provider to see if the HeartScan is right for you. And to make an appointment with New Mexico Heart Institute or Lovelace Medical Group, please call 505-841-1000. By mentioning this presentation during your HeartScan, you will receive a free gift. Thank you so much for your time today listening to my presentation about heart failure. If you ever have any questions or concerns, you are also welcome to reach out to the New Mexico Heart Institute or the Heart Hospital of New Mexico. I hope you all have a wonderful year.